Before the pandemic really had hit in the States, it was pretty clear that there were immune complications of the disease. And so people like us were reading those reports and sort of thinking about what we might do when it was our turn.
So a lot of the research we do here at BRI and in my lab involves using blood from either healthy people or from people with autoimmune diseases. And that all really starts with this amazing group we have here at BRI, so the translational and clinical cores that coordinate bringing in blood donors so that we can assess their white blood cells.
So we had this system set up, and we were about to move into studying autoimmune disease. We were going to study Crohn's disease and begin to study lupus. And then the pandemic hit.
And we were able to turn that system and make use of it to understand COVID. But it was really something that's been built over years because we've studied autoimmunity, right? So we had this whole world built, basically, that we could turn.
So what we did there was to say, well, this same approach could be used to try to study patients with COVID-19. So we used the same approach, but instead of using autoimmune patients, we were starting to get blood samples from patients who are across the street in Virginia Mason with severe COVID-19.
Because we have that registry and repository system up and running, we have teams of people who know how to get samples from patients and who know how to process those samples. And those people were on 7-day-a-week duty for 6 months. You know, most businesses kind of started to close around the middle of March. Most of the schools were closing around the middle of March due to the pandemic. By the first week of April, we were up and running 7 days a week to have those samples coming in and right back out the door to scientists to try and understand what was happening.
So we were only really doing essential work, keeping things maintained in the lab with minimal staff. I've been amazed at how productive everyone has been.
Part of my lab studies viruses. We study Ebola virus and influenza virus. And so what we were able to do very early on was take some of the findings that we'd found in Ebola and influenza research and quickly apply them to COVID. There are a lot of similarities between COVID-19 and autoimmune disease, we're beginning to realize. SARS-CoV-2 can use a similar process of infection as Ebola. So we quickly took the cells that we had, that we had manipulated to make them resistant to Ebola, and we said, well, are these cells resistant to SARS-CoV-2? And they were.
One thing that's interesting and actually relates back to some of the research we do in my lab is this topic of cytokine storm, which we're very interested in, because cytokines are what's made initially when you have an infection to tell the rest of the immune system to come in and fight the infection.
Once you're already infected, some people are going to get very, very ill and they're going to end up in the ICU, and others are going to be pretty much fine. They're not going to feel great, but they're going to be able to spend their week or 10 days at home and feel better at the end of that time. And we designed a study to try and understand that.
I was excited to participate in the vaccine trial, the Pfizer vaccine trial that we're doing here at BRI, because as an immunologist, I really believe in vaccines and the power of vaccines to protect us from infectious diseases. And I've actually never had the opportunity to participate in a clinical trial before, so I thought it was a great way to really show my belief in immunology and how it works, and to give back to society in a different way than I usually do by just doing science.
This research might identify pathways that we could use against future pandemics that we still don't know about yet. Here is a new approach that we could quickly use against new viruses as they emerge to try to find mechanisms of resistance.
The kind of baseline here is that we come to work every day to help people with diseases. I think we saw an opportunity to contribute our knowledge and to contribute, what we already know. So much of this disease is really in our wheelhouse that it would have been a sort of shame to not bring that to bear here.
We knew she had a high risk for type 1 diabetes when she was a baby, and were being monitored over the years. When she was diagnosed, she was 9, and she was just starting to get more independence from me. And it's been scary, but it's also been really eye-opening on how brave she is and resilient. She was just like, okay, let's get finger poke, and then I'll take some shots for insulin. and she just can manage it as a 10-year-old. It's pretty impressive.
It's been hard, but sometimes it's easy because a lot of them have diabetes, almost all of them, and they deal with that too.
People with diabetes are being so heavily impacted by COVID that I really wanted to focus and try and understand that kind of relationship between diabetes and COVID. And it seemed like a place that I could continue to contribute to sort of our understanding of diabetes too.
I'm impressed by the approach of trying to help all autoimmune diseases because they are interconnected. And so if we can figure out why people are suffering from autoimmune diseases, it will take a large chunk of medical needs off the table.
I think in a way we're lucky because we're able to be part of the response to this disease, right? We're able to be part using our sort of scientific tools that we've been developing over years to understand the immune system, taking advantage of the clinical tools and the clinical teams that we have to run these vaccine trials.
But the next stage is really to position ourselves so that we are understanding now what the long-term consequences might be, so that we're in a position to help people if they develop those problems further down the line. So I think that the research now is important, not just to cure the disease that we have now, but to actually understand what might be happening in the future.